Are you over it, suffering from pandemic fatigue? Well, some of us are really struggling with this, and we might need a mood boost. So I've invited Dr. Amna Husain from Pure Direct Pediatrics in Marlborough, New Jersey, to talk a little bit about this because she's been writing about it on social media. Doctor, nice to have you with us.
Thank you. Thank you for having me, Carlos.
Here we are, both of us with a smile on our face. We seem to be handling it well. Are we masking something?
You know, I think you have a really good point, and I'll say that I'm guilty of it as a physician. I think that I'm supposed to be, and in some ways maybe we are, you know, the front line and the poster child of everything you're supposed to be doing right. And it goes beyond masks, but it also, you know, goes to doing the right thing for the public health. But behind the scenes, I'm someone's wife, I'm someone's mother, and it gets really hard, you know, to take all the precautions we are and still go on with our day-to-day lives. And like you mentioned, I'm in New Jersey, so we're working on month 4 of this, and we still haven't lifted many restrictions. And I think we're doing the right thing, but that doesn't mean it's easy all the time.
Well, you said a word that's I think it's kind of grating on everybody's nerves now, restrictions, what we can and can't do. And, you know, we try to believe the science that's out there, but there's so many different things being tossed out into the ether that we don't really know what to believe or who to believe. And so we're confused and we're frustrated, and some of us are angry, and we feel like we're in this little box. What can we do about that?
Sure, you bring up a really good point. I mean, the hot topic, the topic that's being buzzed about lately is reopening schools, right? Yeah. People are like, what do you mean reopening schools? Didn't you say to close them? But we've learned a lot more now than we did back in March when we closed schools. And again, as pediatricians, our job isn't just physical health, but it's mental health as well. So we really make recommendations with a lot of things in mind. And I think that's what you have to think about when you take all this information in. Who are the reliable sources? And to be honest, I'm looking more to public health officials, scientists, physicians, people who see this virus every day and know what's going on, know what the workings are, know what the numbers are right now, and what's safest. Now, again, that doesn't always mean it's easy. You know, like I said, and it doesn't always mean every state's going to be the same. You know, like we might open schools here in New Jersey because our numbers are lower now, but places like Florida and Texas, I don't think they're ready yet.
Yeah, things are spiking there as we tape this interview, but things always keep changing. So, yeah. So I talked a little bit about the frustrations of being locked up in your house for an undetermined amount of time, having to wear a mask when you do go out, being worried. So our mood can really take a hit. Our psyche can take a hit. So what kinds of things do you tell your patients? What do you tell your friends and family about how to keep yourself positive?
Sure. Well, I think, you know, the thing that we'll read everywhere that everyone's saying is take care of yourself, make sure that you're checking in, self-care is important. But when it comes down to the nitty-gritty, what does that really mean for all of us? And I can't speak for everybody, but I can speak for myself as a busy physician mom. Sometimes taking care of myself is the last thing on my mind. And I think it's not a big deal because I understand we have to do this for the greater good. But we really only have, you know, batteries to go so long. And it looks like this virus is going to be here for a long time into 2020, a long time as we're coming closer to the fall and even the winter cold and flu season. So there's a couple of things that I recommend, and this works for a majority of people. Many of these work for me. So the first thing is getting outside. You know, the sun, being outdoors, it's a natural mood booster. I don't know about you, but definitely even just being outside for 15 minutes, even once or twice a day, it really makes all the difference. There's something about nature, there really is. And so even if you have to take a walk with your kids, it's a nice distraction for them too, because they're probably cooped up in the homes. On that note, other things that are natural mood boosters, exercise, definitely, it's really good for endorphins. And one thing that many people may not know, but volunteering actually also. Helping others naturally can really release feel-good hormones. And this is a time when a lot of people are desperate for help. There's no shortage of volunteers anywhere, in any community. I don't care what state is doing what. If you're in a good place or a bad place with the cases, everybody could use a volunteer. Even if you're just going to go next door and help out your neighbor and drop off a meal. I think those kinds of things, they keep your hands busy, they keep your mind busy, and when you come home, you have a full heart. So don't underestimate that. But on a more level, I think, something that I've let slip is my sleep hygiene. And I'll say this is one of those doctor's orders that I didn't follow. I really recommend parents take care of their sleep, and they take care of their children's sleep despite having difficult to follow routines at this time. And I myself, I sometimes will watch TV or scroll on my phone, and then I wonder why I have restless sleep. And when I let go of those habits, as I've picked up on them during the last few months, I realize my sleep improves. When my sleep improves, my mood improves for the day.
Yeah, so we're so addicted to technology, and so many of us have become certified binge TV watchers. So we waste a lot of time just sitting in front of the TV, and that's not good for your health at all.
No, it's not. And you know what? I will say this, though, that if that 1 or 2 hours of TV that you get as a parent after your kids go to bed at night is your self-care, that's totally fine. Yeah. Just make sure you're setting it off 15 minutes before you close your eyes for going to sleep. It really will help set sleep rhythms in a more healthy way. And on that note, in terms of screens throughout the day, we're a very much Zoom-friendly, Skype-friendly generation right now, with all the quarantines and sheltering at home. Try as hard as you can to keep a good grasp on some screen time, even for your kids. We kind of have let some of the rules and restrictions go out the window when it comes to screen time for kids, but if you're finding that it's making them act out a little bit, which it can, it's okay to kind of rein that back in a little bit.
Well, Dr. Amna Husain, thank you so much. Some great ideas, some great tips. We wish you good health and be safe. And thanks so much for spending some time with us.
Absolutely. Thank you for having me.